radiology, we do the diagnostic exams. So for the surgeons, we lay out a roadmap to be able to guide them when they do surgery. For the internists, we're trying to identify disease that may be causing the patient's symptoms. We try to pick up disease before patients have problems or even know that they have it, which is why we do mammograms, to try to pick up breast cancer early enough that patients will be cured. We do DEXA exams to be able to identify who has a low bone density so that they can be treated before they get a hip fracture. We do calcium scores to be able to identify who has coronary artery disease, to try to encourage them to quit smoking if they smoke, to help them get their cholesterol down. We're doing virtual colonoscopies, which is an alternative to doing a colonoscopy under sedation, which is a less expensive, less risky way of identifying colon polyps, which, if they're removed, means that they won't get colon cancer. So it's very diverse what we do. You get to work with patients of all age ranges. You get to work with physicians from all specialties and medicine. So it's probably the most varied of any of the medical disciplines. And on top of that, we have an amazing amount of technology. So in addition to being able to take care of a lot of patients, we get a lot of good play toys on the technical side. All of the equipment we work with are very high-tech computers, and so it's a very technical field to be in. I don't know that there's one favorite part. It's the composite of the whole the field that makes it more fun. It's fun. I would say probably my absolute favorite is being able to tell a patient that's been extremely worried about a particular diagnosis. Say they've been diagnosed with lung cancer in the past and they've come for follow-up, and I can go out and tell them everything looks fine and that I don't see any evidence of recurrence. And that gives them, they're just so thrilled. It's nice to be able to give out good news. Probably the saddest thing is when people come in and they're clearly very sick, and we're in the position of diagnosing that they have a disease that is going to require surgery or radiation or chemotherapy, and we know about it before anybody does. You almost sometimes feel like you've got a crystal ball and you know where that patient's headed before they do, and sometimes that's very sad. But the best part is the people and being able to interact with them and hopefully be able to help them.